As we know, Venetoclax has been extremely successful in patients with CLL, and there are trials ongoing in combination with BTK inhibitors, and that's also the case now in mantle cell lymphoma. The previous phase 1 study with Venetoclax showed a overall response rate of 75% with a progression-free survival of just under 14 months. Interestingly, very similar to ibrutinib. And there's some in vitro data and some cell line data looking at potential synergy with the combination. And in fact, recently, Constantine Tam and his team in Melbourne have published on the combination in a small number of patients and showing good efficacy, really quite high CR rates, CMR rates on PET, and also high MRD negativity. And so the natural next step is to combine with a BTK inhibitor, and that's being done in a large international randomized study. And so by very nature, that's I guess an interesting and important study to look out for. And that's ongoing in terms of its recruitment. Of course, we don't know what the tolerability will be of that combination. We assume that it will be reasonably good, but there's been recent data about the tolerability of BTK inhibitors in the real world that's not been perhaps as good as we'd hoped for, and has certainly led some questions in terms of the tolerability of BTK inhibitors. And there are certainly some overlapping toxicities, such as diarrhea, cytopenias, particularly neutropenia. So we'll have to see about the tolerability in the relapsed refractory setting in mantle cell lymphoma.